Hey guys, so today we're going to talk a little bit about the consultation with your facial plastic surgeon. I would say that many patients finally get the courage to pick up the phone or type out an email, schedule a consultation. Then sometime, in the hours to days that precede that, they start to chicken out and they get nervous about it, and so they call or email and cancel. And I think part of that may be that they don't understand exactly what's going to happen. So even though you're going to see a facial plastic surgeon, I think you should think about it as going to see any of your other doctors. So you're going to come in, they're going to ask you a focused history, right? So they're going to see, what medical problems have you had in the past? Have you ever had any surgery or other procedures on the face? Because they need to get a global sense of, what the best, surgical or non-surgical procedure for you is. And you don't want to do anything that's unsafe. So typically after you discuss these types of things in a history, you would then do a physical exam. And so often this is quite limited, like I have a scar or I have a wrinkle that you don't like. And so that's pretty much the extent of it. I only do facial plastic surgery, so basically from the collarbones up, so it's usually pretty apparent what the patient is there for. But after you've done your history and you've done your physical exam, and often we'll take pictures for the patient. Sometimes you can use a mirror and it's pretty easy to explain something, but sometimes it's easier if both the patient and I are looking at the pictures. We also have image morphing software, so we can take the images and move them around to give the patient a better expectation as to what's potentially able to be accomplished. I can make the picture look perfect, but if we don't think that's realistic based on the patient's cartilage structure or bone structure or skin, well then that's kind of pointless. I'd like the patient's expectations to be able to be met, so I want to change the image in what I think is possible, not necessarily what we think is perfect. So after you come in, you talk with the doctor, you do a physical exam, you take some pictures. Very often you can meet with one of our folks in the business office. They can give you thoughts and ideas on what the timetables for these sort of things are, what the cost is. Most of the surgical procedures are not done on that same exact day. But there certainly are exceptions, and often patients maybe will have traumatic accidents or be bit by a dog or fall down or in a car accident and things of that nature, and so very often we will try to get to that immediately for them. That's kind of what to expect if you come in to have a consultation with a facial plastic surgeon. Let us know if you have any questions. Thanks.